Okay, so we're doing session 4 today, session 12 today. So we're looking at ear, nose and throat therapeutics. So we're just going to first of all just run through a case, but we'll go through that at the end. So we're just looking at a female 16 years old with acute tonsillitis. So she's had it for 3 weeks in duration. 5th episode in 1.5 years, and they've all been treated with antibiotics. So the doctor has recommended a tonsillectomy, but the patient wants to avoid that. So we've also got bilateral enlargement, so both sides, and lots of redness, and the left side is pustular. So there's intermittent fever, moderate persistent malaise, anorexia, weight loss over the last 2 weeks. So, and just a little bit more about that case. So past history, as a child, has suffered from frequent otitis media. And so that's always treated with antibiotics. She had a grommet at the age of 6 years in the left ear. Recently discovered that she's got a dairy allergy, which she's now avoiding. Pathology, so no EBV, so no Epstein-Barr virus, and elevated ESR. So an elevated ESR, so obviously there's inflammation there, and that can link into things like infection, rheumatoid arthritis, rheumatic fever, vascular disease, inflammatory bowel disease, all those sorts of things. So if you want to just keep that case in mind, and we'll come back to that one. So ENT disorders. So most of them have a short duration and a self-limiting. Treatment's controversial. So it can be significant. So if there's hyperpyrexemia, so really high fever, so that would be above 41.1 degrees Celsius. If there's complications and tympanic membrane rupture, and it's important to watch for red flags. So just as a general rule for ENT issues, what do you think you want to do? Like what sort of things do you guys want to do for ENT infections?
Reduce inflammation.
Yeah, reduce inflammation. What else?
I did change.
Oh, sorry, I didn't catch that one. What was that one? No, we must have lost someone. Anything else? What else would you want to do? Anyone?
Anti-inflammatory.
Yeah, so anti-inflammatory.
Well, sorry, you obviously want to fight the infection too, so whether it's bacterial, you might need an antibacterial.
Yeah, definitely. Yeah, and you might need to, anything else that someone's thinking about?
Would you be wanting to, even though that you need to treat all those other things, be trying to do things to support their immune system?
Yep, definitely support their immune system. Yep.
Would you do something like to reduce like mucus production as well?
Yeah, so you could reduce mucus production as well. And then if the mucous membranes are really inflamed, what do we want to do? So just
Decongestants.
Yeah, decongestants. We might want to soothe them a little bit. So we might want to think about demulcents and things like that.
Mucosal trophobacteritis.
Yeah, definitely.
Expectorants.
Yeah, if there's lots of mucus, yeah.
I need to get it up.
Or mucous membrane trophobacteritis.
Yeah. What about, I just went through some red flags as well. Have you guys got any ideas of some red flags that you might need to possibly send them back to the GP for?
Fever or fever with a rash.
Yeah, that'd be a good one. So high fever. What else?
Bleeding.
Yep. So if they're like even coughing up blood or nasal bleeding, yep, that's a good one.
Obstruction.
Yep. So if their throat becomes obstructed, so that can happen with like tonsillitis and things like that, where you get those really enlarged tonsils.
Or ears.
Yeah, or ears. Yep, that's a really good one. So if the ears are getting blocked and they're having trouble hearing.
Look at environmental factors, so like where they're living, if there's mold or anything like that.
Yeah, yeah, definitely. So that's a good one. And what about, so in that case that we were looking at before, the girl had a lot of weight loss, didn't she? So we might want to, if someone's losing a lot of weight, we'd probably need to refer them back to the GP. And I've got as well here eye symptoms. So maybe if they've got, you know, sort of like a throat involvement and start getting swelling of the eyes, you might want to send them away to get that looked at. And also if the infection's gone on for quite a long time as well, so you might want to send them there. What about in children? So it's a little bit harder in children. What signs do you think you could look for?
Fever's the key one with kids.
Yeah. Yep. So if the fever's going really.
Rashes.
Yep.
Hearing loss.
Drooling.
Yep. So any kind of worsening symptoms as well. So if the symptoms are going on, getting worse. Again, if they're coughing up blood and things like that. I've also got here facial swelling as well. So if they've got something like that, you'd want to send them away.
Or recurrence.
Yeah, so if it's really recurrent, which often can be, so yeah, you'd want to just get them checked out by the GP because they could have something like polyps or something, couldn't they?
Yeah.
If they have significant pain with ears as well, like they're
Yeah. Yeah, so that can be really bad. So yeah, just if it's really severe. So just going to go on to talking about a cough. So, so there's an importance in understanding the cough. So what have we got here? So it can originate from the throat, so from a postnasal drip, or they're saying here, so you can get seeding, the upper respiratory tract seeding the lower respiratory tract. So i.e. like infection travels down the respiratory tract into the lungs. I know if patients have got like a lung insufficiency, like sometimes that can happen if they get sick or they get a virus and then it'll go down, like it'll start up in their upper respiratory tract and go down into their lungs. I think as well, there can be also some periodontal complications. And I just saw that, so you can get upper like respiratory tract infections that start from periodontal issues. So people can have issues with their teeth, and that can go down into COPD or pneumonia as well. What about some of the differential diagnoses of a cough? It can be a bit tricky sometimes. Has anyone got any ideas?
Asthma?
Yep, so asthma, yep.
Smokers.
You'd first want to differentiate whether it's a productive cough or a dry cough.
Yeah, yep. So if they're coughing up mucus and yeah, or if it's just a dry cough. Yeah, and someone said smoking. So yeah, if someone's been smoking. What else? There's another one that's a bit of a tricky one.
Chemical ingestion.
Yeah, they could have that. What else?
COPD.
Yeah, so pneumonia. Yep, if it's more severe. What about? Is there any like gastro conditions that you think can cause a cough?
Reflux.
Yeah, reflux is a really common one because it can, and sometimes people don't know they've got reflux. And sometimes when I'm taking an initial consultation, and someone's got like a cough that's just been ongoing, I'm just thinking, is this reflux or is this like a respiratory thing? Because they can have that as well. So another one, bronchitis, or really in a more severe case, they could have lung cancer or some pulmonary fibrosis and that sort of thing as well.
I just had a thought. Some blood
Yeah.
pressure medications actually cause a cough, don't they?
Yeah, they can. Yeah, yep. So that's another tricky one as well. So sometimes you have to send them back to the GP. And there's, you know, a lot of times where I'm looking at patients and I'm going, oh, I think that, you know, what they're on is causing their symptoms and that they need to get it checked out. Yeah, so sometimes, you know, I'm writing letters to the GP saying, can you just review all of these medications, especially with blood pressure. Sometimes they're on like, you know, 2 or 3 different blood pressure medications. So we've gone through most of these red flags. So we didn't talk about things like vomiting. We talked about pain and swelling. And we didn't talk about balance, but that would be linked in with hearing loss, wouldn't it? And a bit of confusion as well. So we just need to watch that with red flags. So antibiotic resistance. So we know that there's been significant overprescribing over the years. Even tonsillitis sometimes doesn't respond very well to antibiotic treatment, and kids have really recurrent tonsillitis. And often that can be because the public's going to the doctor and they want a pill for every condition. So they want, you know, they want the doctor to prescribe something thinking that it's going to fix them. But we know that a lot of these conditions are quite chronic, and the antibiotics aren't always fixing them. Then we've got resistant microbes, and then we've got resistant genes that can go into other non-resistant microbes as well. So that can cause issues just with treating them. So they do their place, which we know, and a lot of us would be really stuck without antibiotics. So we just want to, so we were just talking about some of those classes of ENT medicines, or with the actions that we wanted. So what was, someone said mucous membrane trophorestoratives. What else would you want? For upper respiratory tract infections.
In terms of actions, do you mean?
Yeah, actions. What else? What else would you do?
Demulcent?
Yep, demulcents. What else?
You might want an astringent.
Yep.
Anti-inflammatory.
Yep.
Anti-catarrh.
Yep.
Antioxidant.
Yeah, that could be good to heal the lungs, couldn't it? If there's like some lung.
Antimicrobial.
Yeah.
Mucolytics.
Yeah. What about if they've got an infection? So,
Antibacterial.
yeah, antibacterial. You might also want to.
Antimicrobial.
Yeah. So other ones that we just didn't cover. So anti-allergics, obviously, if there's an allergic component, immunomodulators. So just to modulate the immune system. Diaphoretics, so sometimes we want them to mount that fever or just to help them get over the infection. And I don't think we didn't mention lymphatics either. So anything else that we talked about? Anti-inflammatories. So anti-catarrhs. So they will decrease the formation of mucus. So catarrhs are build-up of mucus in the airways or any cavity of the body. So it can be in the gut as well. So the term's old, so people don't often use it these days, and that can be divided into, so anti-catarrhs can also be divided into astringents, anti-inflammatories, decongestants, mucolytics, antimicrobials, lymphatics, and mucous membrane trophorestoratives. So I would love you guys, we're going to go through some herbs. So astringents. So do you know what euphrasia is? The common name for euphrasia?
Right.
Right, yeah. Yeah. And how does anyone think about using these? Is there...
Why not? As long as him and Michael have the ability to change.
Oh, sorry, I couldn't quite hear that.
Maybe like as an eye wash.
Yeah, you could. Yeah, that'd be great. Also, like when I think of eye bright, I'm thinking lots of mucus. So that's one of the keys that I think of. And I'm thinking like, usually I think upper respiratory tract mucus as well. And then Sambucus nigra. What's that one?
Elderberry.
Elderberry, yeah, yeah. And what are some of the key actions of elderberry? So obviously it's an astringent.
Antiviral.
Yeah, yeah. Has anyone tasted Yeah.
See what that answer was, people. Sorry.
Sorry, what was that?
I didn't hear the last answer. Sometimes I can't hear what the other people are saying.
Yeah, I'm having trouble. It's like it's going in and out with some people's connections. Has anyone tasted elderberry?
Yeah, it's great.
Yeah,
it's awesome. Yeah. So a lot of and what about antimicrobial herbs? How do they taste? Most of them. They're pretty gross. So I actually really like putting elderberry in my mixes because of antimicrobial mucous membrane trephor restorative herbs can be really disgusting. So elderberry can just really be really good and also really good for children as well. So yeah, it's a great one.
Calendula is quite a nice one that's not too yucky as an antimicrobial.
Yeah, yeah, that's a good one as well. About Mercia cerifera. Does anyone know what that is?
No, I've never heard of it.
But it's bayberry. Yeah, I haven't used it very often. So it's also a diaphoretic. It's a circulatory stimulant and it's good for a sore throat. Salvia officinalis.
Sage.
Yeah. Sage, yeah. What's sage good for?
Oh, lots of things.
Yeah, yeah, it is. Yeah.
Antiviral.
Yeah.
An antimicrobial?
Yes.
Anti-inflammatory, antioxidant.
Yeah. What about, oh, you know what Camellia sinensis is, don't you?
Tea. Yeah.
Green tea.
Green tea, yeah. So, and they're saying here, so not a primary upper respiratory medicine, however, due to its common availability, black tea can be a useful option. So then our demulcents. So what's the first one? So Althea officinalis radix or folia?
Marshmallow.
Marshmallow, yeah. So that's a really good one as well. So really good one for the use in children as well as adults. And yeah, I've used it in a glycetract or an alcoholic extract as well. And then what about, we know glycyrrhiza glabra, don't we?
Yeah, licorice.
Licorice, yeah. And what about Plantago lanceolata? It's a bit less common. Any ideas? So that one's ribwort.
Plantain or ribwort, yeah.
Ribwort, yeah, not one that I've commonly used, but it's for nasopharyngeal catarrh. That one. And then we've got upper respiratory anti-inflammatories. So first one, Solidago vigourea. So does anyone know what that is?
Goldenrod.
Goldenrod, yeah. So I use that one a lot in upper respiratory infections or where there's lots of mucus as well. What about Scutellaria bicalensis?
Skull cap.
Yep, bical skull cap. So yeah, just make sure that's bical skull cap. What else is that really good for? Yeah, that sort of came in and out, but it's and allergies. Yep, so really good anti-allergic, and we know glycyrrhiza glabra. We've got licorice, Sambucus nigra. So we've got elderberry again, and Matricaria chamomilla, so chamomile. And I think we all know what chamomile's good for, don't we? We've also got Calendula officinalis, so calendula, Salvia officinalis, so sage again. What about Commiphora?
Olive leaf.
So,
Oh,
yeah, that one's myrrh. So has anyone tasted myrrh
yeah.
in a liquid? How'd you go?
Yeah. I put it on my like ulcers and cold sores.
Wow. Okay.
Yeah, I find it. I mean, just like a drop, like from a dropper.
Yeah.
And I actually don't mind it.
Oh, you're good. Well,
I mean, I guess when you've got like an ulcer, it's like, oh, you don't mind.
Yeah. That's a good one. I'll have to suggest that for some clients.
Yeah.
So if I'm ever putting myrrh in a mix, I'm usually using it as an antimicrobial, but it's pretty disgusting. So I go on the low side of the dosage for that. So I'm usually putting in like the 10 ml in 100 because it's pretty disgusting. And also in those sorts of mixes, I'm warning clients as well that it's not going to be very nice. And what about, so yeah, we said olive leaf as well. And we've got propolis. So does anyone use propolis?
Yeah.
No, I haven't used it. Is it any good?
It's really lozenges.
Yeah, propolis lozenges are good. So really good because you can use it topically, so anti-inflammatory and antimicrobial as well. Then we've got our decongestants. So Allium sativum, you guys should know that one.
Garlic.
Yeah. What about Amaracea rusticana?
Horseradish.
Radish, yeah. Trigonella Phenium graecum. Fenugreek, yeah. We got Commiphora myrrha, so myrrh again, Mentha piperita. So know that one?
Yeah.
Peppermint, yeah. Ephedra. So yeah, just known as ephedra. And that one's scheduled. So they're our decongestants. And what about mucolytics? So we've got Allium sativum, so garlic again. We've got horseradish again. What Cinnamomum verum? What's that one? Cinnamon, yeah. Has anyone tried liquid cinnamon?
No.
Yeah.
No.
We were talking about it in yesterday's lecture.
Oh, were you? It's really strong. It's really, I really like it, but I would be checking if someone actually likes cinnamon before putting it in their mix, because yeah, I have known people to be just allergic, like hay fevery to cinnamon. And also, yeah, if they just don't like it, you wouldn't want to be using cinnamon either. So no one else, what did they say about it yesterday in your
I can't really remember, but I just remember us talking about it.
Yeah.
Two different brands, and one was a lot.
That's it, yeah.
What was that? I missed that, sorry.
Sorry, Ian was saying that there were two different brands, and one he had been using, and then he used the other one. But the newer one that was produced was way, way stronger.
Ah,
and
okay.
so take that into consideration.
And was it making people sick, Lynn? I can't remember. Did he say that it was making people unwell?
I think it did.
Gastrointestinal.
Oh, really? Okay.
Yeah.
Yeah, I mean, it can be really strong. So I try and use a lower dose with cinnamon. So I can't remember. I think that's I usually use Herbal Extract Company. I think it's about 10 or 20 in 100. So it's quite low just because it is strong. But if there's a newer one out, maybe it's one of the other companies and that's even stronger. You do find that sometimes that, you know, between the companies, the herbs are tasting different and they can be different ratios as well. And so you just need to, sorry, what's that?
Different countries.
Yeah, different countries. Yeah.
Constituent.
Yeah, definitely. And circulatory stimulants. Oh, sorry, we didn't go through. So what's the next one? Feniculum vulgare. Fennel, yeah. And circulatory stimulants, what can you?
Cola. Got a cola?
Yeah. What I'm just thinking of more diaphoretic ones. What?
Curcuma.
Yeah. What else?
Rosmarinus officina.
Yeah, it's a good one. What about ginger?
Ginger, yeah.
Yeah. Chili?
Yeah.
Has anyone ever had chili in a mix?
No.
Not that much.
I used to use it for mainly for sinusitis and just people that are like really congested, but it's quite a low dose. So I think we can, no, we haven't got that next yet. So cinnamon, chili. So it's only 0.5 to 3 mil in 100, and it's really strong. I remember giving a client 3 mil in 100 once, and she couldn't even really take the mix. So yeah, probably not an awesome one to use in a liquid, but I thought it was a great idea at the time. But yeah, just want to check if people can actually take chili as well. So
the hospital that I was working in during summertime in India, they put a drop of chili extract straight in the nostrils to unblock it. I had it done. It was crazy.
Did it unblock your nostrils?
It unblocked anything. I thought I was gonna die. It was insane.
I shouldn't be laughing that hard, but yeah, it doesn't sound very pleasant.
That it really works.
Yeah, it does. Has anyone eaten chili and it's gotten stuck in the back of their throat? Yeah, I have. And I've actually had trouble breathing a bit when it gets stuck down there. I've been like, yeah. So anyway, don't like doing that with chili. What about lymphatics? So what's the first one? So Trigonella fenugreekum.
Fenugreek.
Yeah. What about Phytolacca americana?
Poke root.
Poke root, yeah. Yeah. Does anyone know about the dose that you could for poke root?
No.
No, so it's a really low dose herb. So I usually, and another one that tastes really disgusting. So I only usually use about 5 mil in 100. The way with poke root, I always just think about, because when you palpate the glands, if they're really like swollen and quite hard, then I'm thinking about using lymphatic to help to clear all that congestion out. So Calendula officinalis, so another really lovely lymphatic, probably a little bit more gentle than poke root. Yeah, echinacea. Yeah, I don't know why that's not there. So that's a lymphatic. So if you guys want to add in echinacea into that. And what's Gallium aperine?
Is that cleavers?
Cleavers, yeah, yeah. So nice one to use, cleavers. And what about our antimicrobials? So we've got Allium sativum, which you guys know is
Garlic.
Garlic, yeah. Baptisia tinctora. It's a trick question. So it's just Baptisia. Baptisia is a funny one. I haven't used it much in clinic personally, but I've just got here. So it's a lymphatic, immune enhancer, antimicrobial, antipyretic, and good for acute and chronic infections. So Commiphora myrrha, what's that one again? Myrrh, so disgusting, another disgusting herb. So sage, Salvia officinalis, so we've got sage. What about, we've got Eucalyptus globulus. I think that one's easy, eucalyptus. Yeah, so what's eucalyptus good for?
Antimicrobial and bacterial.
Yeah.
Antiviral.
Yeah, yeah. Amaracea rusticana.
Horseradish.
Horseradish again, yep. And next one, Olea europa, easy.
Olive leaf.
Yeah, and then we've got propolis again. So we've got quite a lot of antimicrobials. Mucous membrane trophorestoratives. So does anyone know Hydrastis canadensis? Yeah, what else is that good for? Anyone know? Yeah, antimicrobial, depurative. How does that taste?
Bitter.
Yeah, really bitter. Has anyone had liquid hydrasters?
Yeah.
No, I've had it in an eye bath and that was really good.
Ooh, okay. Yeah. Did it stain your eye?
No.
Really?
No,
Okay.
it was in a blend and I put it in an eye bath with water. So I had an eye infection. It was really good for that.
Wow, it must have been really dilute. Okay.
Yeah. Got it from student clinic. I can't remember. It was a while ago. It was a couple of years ago now.
Yeah. So hydrastis is another one that I really warn people, and I ask them first. So I say, can I give you something really, really disgusting that's going to make you feel a lot better? Because I just want to prime them for it being really horrible, and usually they're quite happy with it. And the reason that I say, and then I make up the herbs and I give them the bottle and I say, this is going to be disgusting, because and I do that with some of them if they've got some really gross herbs in them. And the reason I do that is I want to prepare them for the worst, and I want them to just take it rather than taking the herbs home and going, oh, this is so gross, I can't take it. But yeah, people really respond really well because they say, oh, thanks for warning me. Yes, that was gross. But then I find they're more inclined to take it that way.
Yeah, you get used to it after a while.
Yeah, you do. And hydrastis, it stains everything as well. So it's really staining. So you just got to watch where you get it. And it stinks, I think. So calendula officinalis. So calendula. And did you remember what Plantago lanceolata was?
Ribwort.
Ribwort, yeah. And then we've got our immunomodulators and anti-allergics. So echinacea, so that's an immunomodulator, isn't it? And Andrographis paniculata is... Andrographis, easy one. Picorrhiza coroa.
Cookie, I think it's called.
Sorry?
Cookie, I think it's called, something like that.
Poke root, that one.
Really?
Yeah.
No.
No?
Isn't Phytolacca americana poke root?
Oh, it is, sorry. Picorrhiza.
I think it's just Picorrhiza.
Picorrhiza, yeah. What about Astragalus membranus?
Astragalus.
Astragalus, yeah. Does anyone know what else Astragalus is good for?
Adaptogen.
Yeah, it's a really good adaptogen. Do you know what sort of, so it's really good for chronic infections, chronic issues. So also good for chronic fatigue syndrome.
It's an adaptogen as well.
Yeah, adaptogen. I use it in cancer as well, so it's a really good one.
Yeah.
What about Albizia lebec?
Just called lebec?
That one's Albizia. And then what about Scutellaria bicolensis? Yep, bicol skullcap. Yep. Glycyrrhiza glabra, so licorice. Rhamania glutinosa.
Chinese foxglove or Romania.
Oh, sorry, I missed that. What was that?
So, Chinese foxglove, or could just be.
That one's just Romania, and then we've got our Picorrhiza again. So we've got Circ stims. So we've talked a little bit about chili, but it's called well, what's that one usually called?
Chili?
Yeah, or cayenne.
Oh, yeah.
Yeah.
Cayenne, yeah.
Yeah. Zingiber officinalis.
Ginger.
Ginger.
Cinnamon.
Cinnamon, yeah. And then
horseradish.
Amaracea rusticana, so horseradish, so circulatory stimulants. What about diaphoretics? So Achillea millefolium.
Yarrow.
Yarrow, yeah. Tilia, Europa.
Tilia? Is it just Tilia?
Linden.
Linden or lime flower, yeah. And Sambucus nigra.
Elderberry.
Elderberry, yeah. Euphorbium perforatum. Anyone know that one?
What?
No. Anyone? You don't use it that often. I don't anyway. So that one's bone set. So that's a really good diaphoretic, that one.
What was it called? Sorry.
Bone set. Yeah, and it's a really good diaphoretic and used in influenza, severe myalgia.
Yeah, when you've the flu and your bones are aching.
Yeah, yeah. And then we've got Zingiber officinalis, so ginger again. So we'll just, how's everyone traveling? Okay?
Yeah, good.
Yeah, good.
Yeah, okay. So we'll just go into rhinitis. So basically, so it can be acute, subacute, or chronic. So there's sort of two different types. So they can have like watery, thin mucus, or it can be quite congested and quite thick with swelling of the mucous membranes. And they can go between both, can't they? So, and you can see that sometimes when people go from having like a viral upper respiratory tract infection, it might be a bit more watery. And if it moves to a bacterial, it can be a bit thicker as well. So, and then, so we've got key points here just to, because this is going to help us work out how we're going to treat these people. So we've got to work out whether it's allergic or non-allergic. And so if it's non-allergic, is it infectious? So could it be viral or bacterial? Could it be vasomotor, which we'll go into a little bit more? Or could it be rhinitis medicamentosa? So just a few things about that. So it's important to remember different classifications are rarely standalone in clinical practice. So we've got chronic or recurrent exposure to allergens can predispose us to infection. So allergic rhinitis and non-allergic rhinitis can occur simultaneously in the person. So, and I do see that sometimes. So someone will have like hay fever type rhinitis, which is rhinitis. And then if it's quite severe, it can get congested and turn into a bacterial infection as well. So you do sometimes see that. And then rhinitis medicamentosa. So that's a rebound rhinitis, and that's caused when local vasoconstrictors are ceased. So what that means is basically if they've been using, anti-allergy sprays or even corticosteroid sprays up their nose, what can happen is when they stop using those sprays, then they can get a rebound. And we see that with a lot of medications, don't we? So that can lead to dependence on that drug then too. And vasomotor rhinitis, so it's poorly understood. So basically it's rhinitis where there's no cause. So now no allergy can be identified, no infectious agent can be identified. So symptoms can vary. So they can be from that sort of congested type with thick mucus to really watery mucus. And eating can be a common trigger. What food triggers could do that? What are the common ones that could cause?
MSG, no, foods with the
dairies.
What about spicy foods? Really spicy foods, they can make your nose run.
Oh yeah, spicy, definitely. Yeah, and I missed
dairy and wheat.
Yeah.
Wheat, yes, yeah.
And dairy.
Yeah. What about anything else that could? Any other funny ones? What about eggs?
Eggs.
Sometimes people, yeah, I had a friend that had an egg allergy and she used to get a runny nose from it. Any other people? Shellfish? Yeah, I haven't heard of people getting a runny nose from shellfish, but I'm sure it could be possible.
I have a friend who has a sneezing fit when she drinks red wine.
Oh, really?
Yeah, I think it's the preservatives in the
Yeah,
wine.
yeah.
That's pretty funny. Yeah.
Yeah.
Like, oh, you really don't want to drink that, and then 5 minutes later she can't stop sneezing. So.
Oh no, that'd be annoying. So just saying that stress can also be a trigger or worsen existing non-allergic or allergic rhinitis, and we know that we need to just evaluate people's diets as well to see if there are any dietary triggers. What about herbal management of rhinitis? What do you think? So if it's allergic?
Would like high
Anti-allergics, yeah. What else?
Anti-inflammatory.
Yeah.
Would you treat like with an, like just rinse out the nasal passage, with like a netting?
Yeah, you could do that. Yeah. I was talking about that the other day. Has anyone done used an neti pot?
Yeah.
How'd you go?
They're not bad.
It's a weird feeling, isn't it?
It works really well though.
It does, yeah.
It really clears it out, and if you you can't get better, it really shortens the length of a cold or.
Yeah. So so it's a weird, I know when I've done it, I was like, oh, this is a weird feeling, because you kind of have to tip your head and you've got the pot up one side and it just, all the water drains into your nasal cavity and just runs out the other side. You can't make the salt too high. Like, I've done it before, the salt's been really high concentration, which hasn't been great, but really, really good to help to clear out the mucous membranes. So other herbal management, so we've got mucosal trophorestoratives, astringents if we've got a lot of watery mucus, decongestants if there's a lot of congestion, and immunomodulators. So also, and then we've got also consider gastrointestinal medicines, lymphatics, adaptogens, nervines, and then depending on individual patients.
Would the GI medicines be there for food intolerances? Or
Yeah, definitely. Yeah. Because you sometimes have both, don't you? So I've got a patient at the moment that she's got, I was talking about this in one of my classes, but she's had really severe allergies where her throat's closing. But she's also got, she knows she's intolerant to wheat, but it's not, I know her wheat allergy is different because she's getting bloating and things from the wheat. So we did some IgE testing on her because her IgE came back through the roof. So I was just a bit worried because her throat was closing over. So her IgE was up at around 400, and I wasn't sure if foods were also triggering that, but we did some further testing and she's really allergic to sort of cats and I think it was dog dander and dust and things like that. But she's also got food allergies as well. So we know that there's some intestinal permeability there. So in her case, moving forward, we want to dampen down that allergic response. But we also want to treat her gut as well, just to restore that and help with all of that. Does that make sense to everyone?
Yeah, good.
Yeah.
So I gave her, just for interest's sake, I gave her Albizia complex.
Yeah, good one.
So, yeah, I'll grab it actually. It's sitting right here. So Albizia, Bicol skullcap, and that's right, it's got tanacetum partheneum. I was talking to you guys, Michelle's probably heard me talk about these, but
we were talking about it last week.
Yeah, we were, but the reason that I chose that one was because she had a lot of headaches as well, and the tanacetum partheneum is really good for the headaches. Okay. So do you guys want a break? Do you want to get a cup of tea or something?
Yeah.
Yeah. So why don't we have a 15-minute break and we'll come back at 4 o'clock?
Okay, thanks.
How's that sound? That's all right. Everyone's going to have their licorice tea. I know I will.
I'm going to have a calendula tea.
A calendula, nice one. Nice.
Yeah.
Okay. I'll see you in 15 minutes. Okay, so we're just going to head on to pharyngitis. So some key points. So similarly to rhinitis, pharyngitis, so inflammation can be acute, chronic or recurrent. So pharyngitis is inflammation of the throat. So it can be due to an allergen exposure or an infectious agent. And in some cases, the symptom is underlying immune incompetence or autoimmune disease. So important differential diagnosis in chronic pharyngitis is severe GORD. So people can have that, have all of the reflux coming up the back of their throat, and that can cause a cough and sore throat. So herbal management, so things that we want to look at, so local anti-inflammatories to obviously soothe that sore throat, demulcents, and antimicrobials. So if there is, if there is an infection there. So local application and activity is essential. So we want to look at things like lozenges and gargles and mouthwashes. Can anyone think of herbs off the top of their head that they could use for that?
Sage?
Sage, yeah, that's an awesome one. Yeah. Anything else?
Elderberry.
Yeah, you could use that. Anything? Any other ideas? You could use marshmallow for demulcents. Yeah, there's heaps. Sometimes I do it with echinacea as well if I'm making up a mix and, it's got a bit of that in it and just, so whatever I've got in my mix. Often if I want to soothe their throat, I'm getting them to gargle the herbs and swallow them. So yeah, that's a really good way of, getting that onto the back of their throat. So we're going to be considering non-ethanolic preparations of mucilaginous herbs. So mucilage is highly water soluble and not ethanol soluble. So additional high doses of mucilage are required. So therefore high doses of hydroethanolic extracts, so with water and ethanol. So things like marshmallow are needed with ethanol, so potentially worsening local irritation. So just with olive leaf here, so it has both a local anti-inflammatory and antimicrobial effects, and its potent immunomodulating activity. So it can be particularly variable in the early stages of pharyngitis. And sage, so fresh sage as a gargle, can be highly valuable for pharyngitis for a variety of causes. So do you guys just want to take a little bit of time? So what we're going to do, we're going to list the key actions of Salvia officinalis, so sage, which might be valuable in pharyngitis. We're going to look at the key groups of phytochemicals which contribute to these actions and list them with the relevant actions. And yeah, talk about how we would recommend that being taken. So do you want 10 minutes or so to do that, and then we'll come back and go through it all? Yeah, is that it? Yes.
Sure.
Yeah, okay. Oh, oh, sorry, I can hear someone in the background. Yep, so I'll just pause the recording for maybe 10 minutes and let you do that, and then we'll come back and go through it. Okay. How did everyone go? All good?
Yeah.
Yeah. Okay, so actions for Sage, Salvia officinalis, what did you get?
Spasmolytic.
Yep, spasmolytic, antimicrobial.
Antiseptic.
Antiseptic. Yep.
Antioxidant.
Yep, antioxidant.
Astringent.
Astringent, yep.
Mucous membrane anti-inflammatory.
Yeah.
Yep, yep. What about
Carminative?
Yeah. What about phytochemistry?
Flavonoids. So that'd be your antioxidant, anti-inflammatory.
Yep. What
Monoterpenoid, antibacterial, which is the beta thiazine.
Yep, so I've got alpha and beta thione with citriol and borneol.
Camphor, pinene.
Yep.
Camphor.
Yep, I've got also, there's some rosmaric acid.
Is that the
Rosemary.
phenolic glycoside?
Sorry?
Is that a phenolic glycoside? The rosmarinic? Is that the same thing?
Let me check that.
Phenolic acids.
With the astringent, done that one.
Yeah.
Terpenes.
Terpenes, flavonoids, thione, diterpene bitters. And there's 2 different types of sage as well. So there's a Spanish sage that doesn't contain the thione, and the Greek sage only contains small amounts of the thione. So I'm just checking this. I don't know what class the rosmaric acid is. I would have to look that up. Doesn't say in your book.
Flavonoid.
Yep, there is some flavonoids.
The rosmarinic acid is a flavonoid.
Flavonoid.
Yeah.
And then how would you recommend using Salvia officinalis or sage?
As a mouthwash or a throat gargle.
Yep, that'd be really good.
For a tea.
Sage tea gargle.
Yep, that'd be great as well. And I was just looking at any other ideas?
Could you use it in like an oil diffuser to like help the lungs?
Technically you could, because of the essential oils.
Yeah.
I think you'd probably want to inject it a bit more. What about in a herbal throat spray? You could use that.
That'd be good.
Yeah. I actually just saw this on my shelf. Does anyone use this? Herbal throat spray?
Yeah. Yeah.
It's awesome. So in this one, so it's got marshmallow, it's got sage, calendula, echinacea, myrrh, a bit of clove. So that's a really good one that I recommend. I use that myself as well. Okay. Anything else about sage?
Is that spray quite good for the mucus as well? Was it astringent? Would it work to sort of reduce the amount of mucus?
I don't know, because that was with this one. You only do 4 sprays into the throat. I don't think it'd be high enough for the mucus. I think for the mucus, you'd actually want like a liquid herbal extract, and you want to be taking, you blend 5 ml 3 times a day. And if you want to get the same effect as this with more mucous membrane work, so I'd be gargling it and swallowing it as well. Yeah, I find this really soothing, and I know it's antibacterial as well. So
is that a good one for kiddies as well?
I don't think they can take it. I'd have to look that up. I don't know.
Can I ask about the gargling and then the swallowing of the herbal mix?
Yeah.
Is the idea of the gargling to get the infection out? And if you swallow it, aren't you swallowing it back down? Or are the herbs sort of killing that?
You'd hope that the herbs are killing it. Yeah. I just think if you've got like tonsillitis or pharyngitis, and you've got some demulcents in there and antimicrobials, like you really want to get them to the site of the infection if you can, as well as internally. So that's why I do it like that. Yeah, I hadn't really thought about them swallowing the infection, but you'd think that if they're swallowing,
the working.
Yeah, you're hoping that the herbs are working. Let me just look up.
I probably gargle some and swallow some. I don't know if I'd swallow what I gargle.
Yeah, why? To get the infection out?
Yeah,
I think there might be, it might release a lot of bacteria and it might not be able to handle it in the stomach. You know, I'd probably spit it out and actually then drink some as well.
I would have thought that your stomach acid would have dealt with it by the time it got down there.
Should, yeah, it should technically. I was just wondering if the myrrh was contraindicated in children in that, but it doesn't look like it. You can't use a spray, this herbal throat spray in pregnancy, because of the myrrh. Yeah, I don't know if I'd use that in kids. I'd probably use something more gentle, to be honest. I'd probably mix something. Yeah, like you know, really nice glycetract with the marshmallow and calendula. More children. I don't know. I just think with kids, I like to go a bit gentler. They respond really well. So
my kids respond well with just a saltwater gargle.
Yeah, that's what I was going to say. When you're worried about swallowing all the mucus in the throat, you gargle with the salt water and then spit that out if you think it's really infected. Yeah, and then you can do some of the herbs. Yeah, you could do a bit of a mix of both.
Apple cider vinegar is also a really good gargle for a sore throat.
Oh, I haven't tried that one.
Yeah, it works.
Yeah, awesome. I'll have to give that a go. It sounds a bit gross, but
I wouldn't be swallowing that though, like not really strong anyway.
Yeah. So just talk about the common cold now. So common cold is caused by different viruses, and most are afebrile, but commonly results in rhinorrhea, pharyngitis, and cough with malaise is also common. And it's usually self-limiting, so it usually resolves around 7 to 10 days. And so, yeah, basically we want to treat that symptomatically, but we know rest and recuperation are the main things with the cold. So sometimes frequent reoccurrences of colds can indicate a weakened immune system. So we need to work on their immune system as well. So looking at nutritional factors and acute and chronic factors. So acute or chronic physical stress or emotional stress as well. So the impact of the spread of the common cold to an immunocompromised individual, so that can have severe consequences. So talking about our hand washing, covering our nose, reducing social contact, so everything that we're doing at the moment.
Well, some of us are doing.
Some of us are doing, some of us are doing, some of us aren't doing. So yeah, it's a little bit of a tricky subject, isn't it, at the moment? So herbal management, so symptomatic. So I'm always looking at treating the symptoms that they have, as well as addressing their immune system. And obviously we need to address the underlying cause. So antivirals, immunomodulators, looking at fever management. So look, you know, where appropriate, using diaphragmatics, so stimulating the fever, and also circulatory stimulants as well. Has anyone had any issues? Has anyone come across a fever that they've been a bit scared with?
Yeah, my daughter had a febrile convulsion.
Oh wow. Okay.
That was pretty scary.
Yeah. I years ago, one of my housemates at the time had severe headache with a fever, and I measured, so I was monitoring her fever, and I think it went from something like 38.5, or it was 39, up to about 41 within the space of about 10 or 15 minutes. And that's when I'm like, okay, she needs to go to the hospital. So yeah, so just monitoring things like that when people are really sick. So making sure that, obviously in her case, her fever had jumped and spiked really quickly, and I just thought, yeah, she needed a bit more help at that time.
And there are herbs that are mild, so you can use mild herbs if you don't want to reduce the fever excessively, can't you? There are herbs you can use, it will just take it down a little bit.
Yeah, there are. Yeah, but just knowing when to use those and when not to use them. Well, yeah.
Yes.
So key medicines that we're looking at. So Andrographis paniculata is Andrographis, yeah. So echinacea, we know. So Allium sativum, so garlic. Achillea millefolium. Which one's that again?
Yarrow.
Yarrow, yeah. Sambucus nigra, we've talked a lot about elderberry. So Zingiber officinale, you guys know that, ginger. Mentha piperetta, peppermint, and Euphorbium. Again, I know it's a funny one. What was that one?
Bone set.
Bone set, yeah. So we're just going to compare and contrast those 4 herbs. So what do you know about yarrow? So Achillea millefolium, you know much?
Well, it's a spasmolytic.
Yeah.
Diaphoretic. Yeah.
Yeah, diaphoretic. Yeah.
It's a styptic as well, which isn't exactly relevant, but
yeah.
Antimicrobial.
Yeah.
Anti-inflammatory.
Yeah. What else?
Bitter.
Bitter. Yeah.
Tonic.
Peripheral vasodilator. And what would you?
Hemostatic.
Yeah. What would you use that one for?
Common colds, influenza, fever.
Yeah. And fever in acute doses for fever. What about Sambucus nigra? So elderberry.
Yeah, that's for influenza.
Yeah.
Fever, headaches.
Antiviral. Yeah.
Symptoms of a cold or influenza, really.
Yeah, and it's really antioxidant, isn't it? That one. Yeah. What about peppermint? So Mentha piperetta.
It's a cooling, isn't it?
Yeah, it is cooling. When can't you use peppermint?
In reflux.
Reflux, yeah. I had a client a few weeks ago. Anyway, she was getting reflux and she was drinking like 4 or 5 cups of peppermint tea a day. So I just said, maybe we'll just swap that one out and put in a different herb.
It's good for the sinuses.
Yeah.
The guitar.
Yeah, so it's good for guitar. What else?
Cough, influenza, colds.
Cold, yeah.
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 It's also a bit of an analgesic, so the sore throat, it would be good.
Yeah. And it's a carminative, isn't it? So if someone's got gut issues as well, it'd be a good one as a crossover. And what about bone set? Or Euphorbium?
Good for bone pain.
Yeah, the bone pain. So that one's a bit easier. So it's a diaphoretic.
So guitar again.
Yeah, and yeah, it's the flu with the bone pain or the pain.
Influenza.
Yeah. So you guys happy with that one?
Yeah.
So we're going to do a bit of an activity on tonsillitis. So general objectives for tonsillitis. So we're considering about what the cause and the pathophysiology are. So developing a list of key treatment objectives, listing classes and medicines that we would look at, and also consider and indicating what herbal medicines and providing a rationale for each, and what limitations you could encounter with herbal treatment of tonsillitis, and how would you get around these. So you've got a bit of a table here. Do you want to take, how long to do that? 5-10 minutes? What do you guys think?
Yeah.
I'd be a bit, well, it says 30 minutes, but do you want to do it individually? How long? 10 minutes?
Yeah, 5 or 10.
10? Yeah, so let's take 10 minutes to complete that. So I'll just check what time it is. So we'll come back at 4:40 and then we'll go through that. Okay, so what did you think for your general objectives for tonsillitis? What did you want to do?
Well, eliminate the infection because usually tonsillitis is due to an infection.
Yeah, yeah. So eliminate infection. Yeah, and what actions do you want for that?
So antibacterial or antimicrobial.
Yep. And what? Sorry.
Antiviral.
Yeah. Yeah. And then what medicines or what herbs would suit those actions?
So Camifora myra.
Yeah. Yeah.
Yeah, officinalis.
Yep. So we've got myrrh or sage. Yep. What else?
Melissa officinalis.
Yeah. So if it's topical antiviral, were you thinking?
No, I was thinking internally.
Internally, okay.
Yes, because it's good for quite a lot of things. The lemon balm.
Yeah.
It's also sedative and helps with fever, controls fever, and aids sweating.
Yeah. What are any other herbs anyone was thinking about?
I was thinking
Echinacea. Sorry.
Echinacea, yeah.
I was thinking Thymus vulgaris to reduce infection.
Yeah, that's a good one. Any others that anyone can think of?
Echinacea. I was thinking the echinacea root is good for the swollen lymph glands, and it's good for chronic and acute infections. It's also anti-inflammatory and for immune modulating, enhancing.
Yeah. Anything else?
Sambucus, maybe.
Sorry, I didn't catch that one.
Sambucus.
Sambucus, yeah. So, yep, elderberry. Yeah, and there's another gross one I was thinking about for infection that I was talking about before.
I like the sage one you were talking about.
Radish.
Sage. So golden seal you could use as well for the infection. And then, because that's like good for mucous membranes, also antimicrobial, that sort of thing. It's pretty gross though. So what other objectives do you want to work on in tonsillitis?
Controlling pain and fever.
Yeah. So
a mild sedative.
Yep. So you might want an antipyretic. Is that what you're thinking?
Is it more diaphoretic?
Diaphoretic. Yep. Diaphoretic. What herbs were you thinking?
Yeah, is good for that.
Yeah.
What was the herb?
Echinacea, the diaphoretic.
What else? There was another diaphoretic we were talking about before.
Alchemilia millefolium.
Yeah, so that one. We were talking about, probably not in this case, but I was thinking bone sets are diaphoretic, but probably wouldn't use that for tonsillitis. Yeah. So what are other actions or things do we want to do?
Maybe improve the integrity of the mucosa.
Yep.
Spasmolytic.
A demulcent?
Definitely.
Demulcent, yeah. So that was one of the big ones. So I was looking at, first things on my list were reduce the infection. So we want an antimicrobial. Then I had to soothe the throat. So a demulcent. So what's going to be a really good demulcent to use?
Marshmallow.
Yeah.
Or verbascum.
Licorice. Licorice is a good one. Yeah.
Pantega lanceolata.
Yeah, you could use that. What about what's your next objective? What's another objective too?
Well, I thought of like a supporting the lymphatic tissues.
Yes, that's a great one. Yep. So what are our lymphatic supports?
Echinacea.
Nice ones, yeah. Echinacea, and echinacea's got a really good crossover effect, hasn't it?
Yeah.
Yeah. So, and then what else? There's another really nice one you can use for kids that tastes nice. We spoke about.
Elderberry.
Elderberry.
Yeah, I was thinking calendula is a really nice lymphatic.
Oh yeah.
Yeah. And what about another objective? Someone's dog going off in the background.
Yes, mine's
Would you want to do something as in an antioxidant?
You could. I'm thinking more an anti-inflammatory.
Yeah, I had that.
Yeah. So did we didn't talk about anti-inflammatories?
We did.
Yep.
Yep.
Salvia officinalis.
Yeah.
You can use licorice.
Yeah, we could use licorice. That's a good one. Yeah.
I had Scutellaria bacalensis.
Okay. Yeah. I would be using that more if there was an allergic component, but you could put that one in. Echinacea is a bit more, I think, a bit more specific, depending if it's just infected or if it's allergy. But usually with tonsillitis, you're just looking at infection. And what about anyone else had that we haven't covered?
Well, I also said that for stressful times, because they might go through stress, you'd use an adaptogen.
Yeah.
You could, yeah. What were you thinking?
Probably astragalus, because it has that benefit as well for upper respiratory tract.
Did you say astragalus?
Yeah.
We wouldn't usually use astragalus in an acute infection.
Okay.
So I probably wouldn't look at that one. Is there?
I was thinking the echinacea again for the like a mild sedative to sort of alleviate pain and aid sleep and just decrease nervous tension a little bit.
Yeah. Yeah. Has anyone heard of echinacea as an adaptogen?
I've used for a mild sedative. It's
yeah.
Kerry Bones says it's an adaptogen, doesn't he?
Does he? Does he?
Yeah,
Oh,
I've read that.
Okay.
He just loves it.
I know it's Kerry Bones' favourite herb.
Yeah, exactly. He must have found the research.
Yeah, okay. So we'll go with Kerry and we'll say yes. So thumbs up to that one. And what about limitations of the herbal treatment? What do you think? What's someone with tonsillitis got? So obviously they got a bit of difficulty swallowing, haven't they? They got pain. What could be the limitation there?
Able to
I guess eating.
If it's their throat's swollen and it's not tasting great.
Yeah.
Compliance.
Yeah, I was thinking of the taste. So how could we get around that?
Well, you could do a lemon and ginger honey tea. That's always quite nice. Ginger.
With the herbs in.
Yeah, just an infusion.
Yeah,
a separate thing, you know.
I was sorry. Go on.
A throat spray.
A throat spray. Yeah, I was actually thinking if we could put a lot of licorice in, that would make it taste better. What else? So you could put it in juice as well, couldn't you?
You could actually just chew on parsley or a mint leaf or something like that, couldn't you?
Yeah, you could do that. I just usually, if people have trouble, the first thing I say is, number one, are they actually diluting the herbs? Because sometimes people forget to do that. So when I give people herbs, I don't have a cup down here, but I say, you know, your herbs go up to here and then this much of water. And I actually point to that because that's a common mistake I've found. People will not dilute their herbs. So make sure they're diluting it. And then also if it's really disgusting, they could put it in juice as well, or depending on.
Or even a teaspoon of honey after the herb is a nice finish.
Yeah.
Oh, yeah, that's nice.
Yeah, they could do some Manuka honey or something like that. Yeah, that'd be good. So we're just going back to our tutorial that we were talking about earlier. So just as a refresher, we've got a female 16 with tonsillitis. She's had it for 3 weeks. It's her 5th episode in 1.5 years. And all have been treated with antibiotics, and her doctor wants her to have a tonsillectomy, which she wants to avoid. So we've just talked about they're really enlarged, they're red, and then one of them's pustular, the left side's pustular. She's got intermittent fever. So what, just as a brainstorm, so the fever's telling you what?
There's an infection.
It's an infection, yeah. So, and then she's got malaise, so she's tired, anorexia, possibly because they're swollen, and weight.
Dehydrated.
Yeah. Then we've got, so she used to get otitis media, so ear infections, and they were always treated with antibiotics. She had, at age 6, she had a grommet in her left ear, and she's got a dairy allergy, which she avoids. But no past history of EBV, glandular fever, and elevated ESR. So we're going to divide into groups, but I'll just run through. So we just want to cover off, so what is your diagnosis and why? What are your treatment objectives and why? And we want to do some SMART goals that are holistic and patient-centered. What method of action would you choose, and what are your objectives and why? And what herbs are most appropriate for each method of action and why? And then to build a formula. Guys,
sorry, Deb, I have to drop out. I've got to go and pick
up
okay,
that's all right.
My partner. Bye-bye.
Yeah, okay. Good to see you, Julie. See ya. All right. So everyone else can hang out and do the toot?
Yeah.
Yeah. Are you happy to do that on your own? Or do you want me to attempt to put you into groups?
We'll have a go on our own. You don't have a little blackboard at the end, do you, to go through it? I'm still working out Zoom. I can put you guys in groups, but hopefully I wouldn't stuff that up.
If you can't put us in groups, what Ian has done this week with Clinical Herbal is he's just shared his screen and opened up just a Word document, and then we kind of started discussing the objectives and the goals first, and writing all those out, and then discussing all the actions.
Yeah. Okay, that's a good idea. So what I might give you, I'll give you a chance to actually answer some of these, and then I can type it up as we talk about it. How long would you like to go through that?
10 minutes.
10 minutes, yeah. So I'll just, so can everyone see my screen? So I've just put a Word document with what we want to go through.
Yeah.
Yeah. Awesome. Okay. So what was your diagnosis?
She's got lowered immune system, probably due to gut dysbiosis from multiple antibiotic use.
Yeah.
And also
so tonsillitis, and then we can put some factors down affecting that. So so she's got lowered immune system and frequent antibiotic use. What else?
She might have low HCl, because that's a crucial part of the immune system, and also, you know, aids in adequate nutrient status. And she's got malaise and anorexia and weight loss.
Yeah, but what can that be from though? Like, I'm thinking really simplified.
Could it be poor nutritional intake because her throat's so sore that she can't eat?
Yeah, yeah. So that's what I was thinking, because her throat's so sore and swollen. I don't know if anyone's had tonsillitis. I had it a lot as a kid.
Yep.
And you couldn't really eat much. So I think she's probably losing weight because of that, because she can't eat. Does that make sense to everyone?
Yeah. I had a question though.
Yeah.
So it says that she has acute tonsillitis, but because it happened, like this is her 5th episode, would it be chronic?
Yeah, she's got acute tonsillitis now, but I would say she it resolves. So you would say many acute bouts of tonsillitis, but you
would say chronic lowered immune system, like lowered immune.
Yeah. The reason I'm not saying that it's chronic tonsillitis is because she recovers. Makes sense?
Yeah.
It's not, she recovers from it, then gets it again. So she still has lots of bouts of it, but she does actually recover from it. She's got...
Because it's not chronic, you wouldn't use anything that has to do with like immune stimulating in that sense, or
for her,
yeah.
What I would be tailoring my treatment to would be, I'd be looking to address the acute infection at the time, and once that resolves, I'd be looking at definitely immune stimulate, like, you know, definitely supporting her immune system long term, so she doesn't get tonsillitis again down the track.
Gut dysbiosis, because if she's anorexic anyway, you know, she could have leaky gut, and if she's been vomiting with anorexia, her acid barrier of her stomach that kills bacteria might be affecting, you know, her immune system as well.
Yeah. So I've got she was vomiting, wasn't she?
Where did the vomiting came from?
Oh, I was just thinking she was anorexic. So
because she can't swallow,
mean
then
like not eating, but lack of appetite due to illness. Not necessarily
that's
like
not anorexia, just anorexia.
No, I wouldn't. She's got anorexia I think as a result of the actual tonsillitis, not that.
Okay, I wondered
the way
anorexia, comma, and then it goes weight loss over the last 2 weeks.
The way it's a bit funny, isn't it? You could read it two ways, but I would say that's anorexia at the moment from the tonsillitis, not actual anorexia.
Get the vomiting bit then.
What does she say? So intermittent fever, malaise.
Also, when you have a fever, you don't have an appetite.
No, you don't, do you?
Where does it say vomiting?
That's what I'm looking for. I'm looking for vomiting. I can't find vomiting.
Oh no, it didn't say vomiting.
No.
I've known people with anorexia that vomit, and I was just thinking, you know, if she had been vomiting, but it's not anorexia. It's just the weight loss.
It is. So it's tonsillitis causing a lot of issues. So causing the fatigue, the fever with the infection, the anorexia, so just loss of appetite, weight loss through that way, not actual having anorexia.
Yeah.
And then she's got food allergies as well. And I know that food allergies can also link to otitis media. So I think that's the link there. And that's why she's had grommets when she was younger. So what are your treatment objectives?
Because she has fever and wouldn't that mean infection? So eliminate the infection would be first.
Yeah.
And then minimize or reduce inflammation.
Reduce pain.
Put that in with that and pain. What else? Any
Would
other?
you do the lymphatic drainage here? Improve the lymphatic drainage.
Yeah. Would you? Just wondering how you could. Would you put? How could you put that into more of a SMART goal or a treatment objective? So.
I'd be more support the immune system via the.
Yeah. Yeah.
Okay.
Yeah. Yeah. So we could say, sorry, via lymphatic support, lymphatic by enhancing clearance. Do a bit more than the immune. Is there any other treatment objectives? Is there, and then we can come back and tweak these.
Do you guys want to make your word screen just a bit bigger so I?
Yeah. Yeah, sure.
Percentage. Thank you.
Yeah, that's all right.
We look at supporting the mucous membrane integrity.
Yeah.
Yeah, I had that too.
Yeah.
Wasn't sure how to actually say it, but she's suffering from malaise, which means kind of like no energy and that sort of thing. So would we be looking at increasing her vitality?
We would. I just think you would. I would say that is more of a long-term goal. So more of an acute goal will be getting rid of the infection and treating that, and then you would be supporting the vitality long-term. So what was, sorry, I missed Wallace. Is that screen better, Michelle?
Thank you.
Yeah, that's all right. Sorry, I missed, someone said one.
The mucous membrane integrity to restore them.
So, restore.
I had soothe throat as a separate goal. I mean, yeah, because there's obviously the inflammation and pain, but yeah, I kind of had that. So you'd have like even analgesic actions under that.
Yeah, yeah. Okay. Any other objectives?
What about her nutrient status? Do we want to enhance?
We would, but I think because we're doing so. Do you mean herbs?
I assume that if you like soothe her throat, she might have a appetite again.
Yeah, to eat a little bit more. Yeah. Yeah. Okay. So eliminate the infection. So is everyone happy with that one?
Yeah.
Yeah.
Yeah. So if I go, and we'll go through them one by one. So what herbal actions do you want to eliminate the infection?
Antimicrobial.
Yeah.
Anti-inflammatory.
Well, I think we'll put anti-inflammatory under minimise and reduce inflammation.
Modulator.
Yeah. Yeah, you could put
Demulcent.
I'll put that, I'm trying to do it through objectives. So I might I'm just going to copy these down. So we've got eliminate the infection. So under eliminate the infection, we've got we want an antimicrobial and an immunomodulator. Yep. Happy with that? Yeah. So minimize and reduce the inflammation. So demulcent.
Anti-inflammatory.
Anti-inflammatory.
Immune modulating as well.
I'd probably
just because the inflammatory response, that was just my thought.
Okay, I'll probably leave those two.
Lymphatic.
Analgesic, is it?
Yeah, so analgesic is another one. Okay, and then we've got those two under that. Sorry, is everyone keeping up with me in the Word document?
Yeah. Yeah. At the end, can we just go back to the beginning so I can take photographs of each page?
Yeah, sure. Yeah.
Thank you.
Yeah, that's all right. So supporting the immune system via enhancing lymphatic clearance and decreasing congestion. So
lymphatic
modulator.
Yeah.
A lymphatic.
Yeah.
Anticatarrhal.
Oh yeah, we've got that. Cool.
Sorry, anticatarrhal, was it?
Yeah, if you're decreasing the congestion.
So not spelled right. That's terrible.
It's CATARRH.
CATARRH. Thank you. Is that right?
Yeah.
Mucous membrane tonic.
Yeah. We were going to put that under. Oops. So here. Anything else?
Any other objectives or action?
Let's go back and have a look. So
what about sedative.
Yeah, for the pain. Yeah.
Yeah, for pain and sleep.
Analgesic and
anxiety, possibly.
Sorry, I didn't hear that last bit.
I was just saying, you know, just the whole situation with constantly having tonsillitis must make, be a bit of anxiety for her all the time.
Yeah, we might just focus on the immune ones, because if it said she was, did it say she was stressed? It didn't, I don't think, did it?
No.
Adaptogen in there.
But I'd feel stressed about 5 episodes in 1.5 years.
Okay.
So antibiotics.
Yeah. So do you want to put that in then, support her nervous system?
Yeah, I probably would.
Does everyone want to pop that in?
Yeah.
Maybe that's the reason my skin is.
Maybe, yeah. It's a pretty stressful time, isn't it?
Maybe the stress comes before the tonsillitis rather than after.
Yeah. Support her. Oh, sorry, we're going to do nervous system. So we want adaptogenic.
With that objective, would you add on to that same objective, supporting her nervous system and increase her energy levels?
Yeah.
Which also has malaise as well.
Yeah, so yeah, then you are addressing the malaise. Yeah, so that's good.
And then the adaptogen is working both on energy and nervous system.
Yeah, that's a good idea.
Yeah, because it wasn't really a complete goal, was it? But it is, I think it's a lot better now. So support her nervous system and increase her energy levels.
It probably ties in with some of the other objectives, but I have one written down about reducing the occurrence and the duration of the tonsillitis bout.
That's great. That's a really good one.
That would kind of tie in, I guess, with the immune modulating, but also make an immune tonic.
Yeah. So what we wanted an immune immunomodulator did you want?
Maybe enhancer.
Sorry, what's the other one?
Maybe an enhancer.
Yeah, amino enhancer. Yeah.
Antioxidant we need as well. Okay.
So, probably, I don't know if we need an antioxidant under that one.
No, but under another
Probably
one.
not.
Could you put it under the support immune system with the lymphatic clearage?
As an
Yeah, that would be a good
antioxidant. We could put it under there.
Or even with the nervous system?
The antioxidant?
Maybe.
Yeah, you could. Probably not there. In there. What herbs did you find for these actions? So should we write some herbs under each of these that would suit? Is that yeah? So eliminate the infection, what herb have you got?
You mentioned before the herb, what was it? Baptisia tinctura?
Yeah.
Sambuca.
Are we doing the antimicrobials?
Yep, so antimicrobial and immunomodulator, is there any? Yeah.
We go for the echinacea for that.
Yeah.
Hydrastis canadensis.
Yeah. What about, so we might just go through and we'll do a few herbs for each, and then we'll go through and choose our prescription. So what about minimize, reduce inflammation? So we've got demulcent, anti-inflammatory, analgesic, and sedative. Is there anything you can think of? Or even an anti-inflammatory? Yeah. All right. No, it's not.
Melissa?
Ribascum, it's anti-inflammatory and antimicrobial.
The sage gargle would be nice.
Yep, it's the same.
Althea officinale? Or officinale?
Althea, yep.
Frankincense?
Do you mean myrrh?
Yeah. Okay.
Is that the one? Yeah. It's not really. Is it? It's not anti-inflammatory, is it?
Yeah, frankincense is a big anti-inflammatory.
Do you mean frankincense or do you mean?
Boswellia. Frankincense is Boswellia serrata.
Yeah.
Oh, Boswellia.
Yeah, it's a really
yeah.
good
Oh,
one.
sorry. Yeah.
And it's also antimicrobial as well. So it can double up with the
The lecture also said under the upper respiratory anti-inflammatories that Commiphora myrrha was an anti-inflammatory.
It is, yeah. So
Just in the slides, I just wrote that note down.
Commiphora myrrha. Yeah. Okay, so then we've got support the immune system, so lymphatic and modulator, anti-catarrh. What herbs would you put under that?
Euphrasia.
You could. Is euphrasia lymphatic?
Sorry, could you please just
Calendula.
Calendula, yep. Sorry, there was someone asking me.
Sorry, could you just scroll up?
Scroll up? Yeah, I'll go through it all at the end. I'll make sure you guys, we're just putting some herbs down at the moment.
I find it easier if we separate by all the actions instead of putting all together.
Yeah. Okay.
Because then we pick and then we don't know which actions are we actually covering, for sure.
Yeah. Okay. So we can do that. So antimicrobial, which ones out of those are antimicrobial?
Hydrastis.
Hydrastis, echinacea.
Yeah. So
Andrographis.
But because it's acute, you can't use andrographis, can you?
No. It's antipyretic, so you I wouldn't because you might want to give him a gargle, and andrographis is gross, so I wouldn't in this case. So sorry, antimicrobial, so we're doing echinacea and hydrastis, and then so then we had immunomodulator, and then so we can pop echinacea in under that, can't we?
Mm-hmm. We have bacteria as well.
Yeah, as an immunomodulator.
And sambuca.
Yeah. Okay, is that better?
I find it easier, but it's just
yeah. No, that's okay. All right. So if we're gonna...
Horseradish.
Just hang on one sec. So demulcent, what have you got?
Althea.
Yeah. So
Verbascum.
Yeah. And anti-inflammatory. Oh. So anti-inflammatory.
Mm-hmm. Wood, hydrastis, clarissa, echinacea, verbascum.
So anti-inflammatory, sorry, what was that? Verbascum, anything else? Is echinacea anti-inflammatory?
I think I have just checked here on my files.
Yeah, it is.
It is?
Yeah.
And how strong it is, then I'm not sure. Sometimes it can be just mild.
I wouldn't, I wouldn't. It's not one that I would think of for that. Okay. And then we've got analgesic.
Would it be Melissa?
Yeah. Is sage?
I don't think that we learned this here with the herbs, but I think the action that clove has when you put it in your mouth and you makes it all numb, would it be like weird to make a gargle for her?
No, not at all. Not at all. So did you mean sage?
Clove powder.
Oh, clove.
I know that people use it for like tooth pain and you like chew on cloves and then you can't feel it because it makes it all numb.
Yeah, it's just quite strong. But
yes, I understand, but that's 3 times.
Yeah. so close. Sedative, so sorry, Melissa, wasn't it? What about, well, Boswellia is anti-inflammatory. Myrrh, where's myrrh fit in? Why did we have myrrh there? I'm going to take that one out. And then sedative, is sage a sedative? Or an analgesic?
I do not have it as an analgesic, but
you don't?
I don't, but
no.
Someone else could.
Okay, so let's break these up. So under lymphatic, so we've got calendula. What else? Echinacea. Everyone a bit brain dead?
It's echinacea lymphatic? No.
Yeah, it is.
Yeah.
Yeah. What else is a lymphatic?
Poker root.
Allium apari. I don't know how you spell that. Sorry, what was that one?
Poker root, but it's
poker root. Yeah. 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 Okay. So this. All right. And then what about immunomodulator? So we've got echinacea again, haven't we, as an immunomodulator? What else? Anything else that is an immunomodulator? Didn't we do that? Yep, so I've got bacteria and sambuca.
I think ginseng, it's modulator.
Is it
rhodiola?
Is it immunomodulator?
Yeah.
Ginseng?
Yeah, and rhodiola. That's what I have from our notes from Material Medical.
Okay, I'm not.
Sometimes it's not a strong one, but
yeah, I might leave it to the.
Yeah.
I might just leave it to the main ones. What about anti-catarrh?
Anti-catarrh. Sambucus.
Yeah.
Echinacea again.
Hydrastis canadensis.
The Plantago.
Yep.
Oops. Sorry, it was echinacea, was it?
Yeah.
Someone say, yeah. Plantago?
Yeah.
Lancelata?
Yeah.
I'm not sure if that's spelled right, but so mucous membrane tonic.
Hydrastis?
Yeah, hydrastis, yeah.
Licorice, verbascum.
Spelled wrong, isn't it? Oh, any of the others? Any other mucous membrane tonics? No. And adaptogenic?
Withania, who's also a modulator.
Yeah.
Withania?
Yeah.
Yeah, that's a good one because that's good for energy as well.
Withania. And then
what about ginseng?
Yeah. So what's one that we've already covered that I'm thinking of?
Echinacea is a good one because that's an energy enhancer as well as a mild.
Because Kerry Bone says it's an adaptogen.
No, not because Kerry Bone, because the Native American Indians used to use it for energy.
Okay. I haven't heard that, but
originally.
yeah. What's another one that's a main one that we?
Licorice.
Yeah, licorice. Yeah. So, and what about, we wanted antioxidant as well, didn't we? So out of any of those herbs that we've listed, so we don't get really complicated, is there any of those that are antioxidant?
Did we put in the sambuca?
Sambucas, Niagara?
Yeah, that's an antioxidant.
Yeah. Okay. And what about immunoenhancer?
Echinaceas.
I'm not sure we want an immunoenhancer because she's in the middle of an acute infection.
That's right, isn't it? Yeah. So the reducing the occurrence and duration of her tonsillitis, we might look at that as a long-term goal. Yeah, yeah. So we might just take that one out. So what? So I don't know if I can get all of these on one screen. What can we just highlight? Maybe some really common ones that keep coming up.
Echinacea.
Yeah. So echinacea has come up a lot.
Licorice.
Yeah. So licorice.
Sambuca.
Yeah. Yeah. What else?
Astis.
Melissa.
Melissa doesn't. I'm just thinking of things that are going to cross actions. So if we're thinking, if we're having a look at something that's going to cross as many actions.
Yes.
Salvia.
Probably the plant. Oh yeah, the plantago is pretty good for a lot of things to do with her.
Yeah, it's just not across a lot of actions.
You said hydrastis, yeah.
The hydrastis would, yeah.
Yes.
So,
and Rebascans crosses 3 actions, I think, as well.
Does it?
Anti-inflammatory, demulcent, and antimicrobial.
Okay, so let's pop those ones in. Just pasted. So echinacea, Hydrastis. And what else do we have?
The elderberry?
Yeah, sambuca. Yeah.
Would you want the sage in there as well? Or not really?
There's one that, hang on, what about the licorice? Yeah.
Oh, yeah.
So, just a question. Do you think it's viral or do you think it's bacterial?
Bacterial.
Bacterial.
Yeah. So, I'm just going to try and get this all on one screen. So, which herbs out of that? So, I've got those both in there. So, I don't think the sambucas is really indicated because that's more for viral. Does everyone understand that? Like, would they agree with that?
Yeah.
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 But
So just
so because it's endangered, would you not use that? Or
you wouldn't have to use it. You definitely wouldn't have to. It'd be up to you really, because what actions is the hydrastis doing? So it's mucous membrane tonic. What else have we got that under?
antimicrobial.
Antimicrobial, yeah.
And tropo-restorative, but yeah, it's not necessary because of the other ones covered too.
Yeah, I actually don't think I don't think we need the hydrastis.
Yeah.
I don't. Verbascum, what's verbascum?
Verbascum is with the membrane, mucous membrane tonic as well, so it's fine to use it. And
also an antimicrobial.
Yeah.
Yeah.
So I think it should be a good.
It's a good one. Yeah.
Yeah.
Yeah. So I'm gonna we'll do this, and then I'll give you another formula as well. So I'll give you what I've gotten down, but we'll do both. But this is still good. So what's the ratio with the echinacea? What are we?
1 to 2.
Yeah. Okay. And what dose would you give for that? Any ideas?
Would you go high?
Yeah, I would. Yeah.
40 mils? 25 to 60. So yeah.
Yeah.
40.
40? Okay.
Yeah.
We'll throw it in and then we'll see how it all goes. What about the verbascum?
That's between 30 and 60.
So you'd have to put 30, and is it a 1 to 2?
Yes.
Okay. Okay, and then the licorice. I haven't spelt that right, have I? Glycorizer.
Just take the A out.
Take the A out, yeah.
Thank you. And what's the licorice?
1 to 1.
1 to 1, yeah.
And it's 10 to 40.
Yeah. So how much licorice do you think you'd want?
You could go the high grade and do it between a 10 and 30.
Yeah. So what if we just put 30 in, because that's what we've got left?
Yeah.
Is everyone happy with that?
Yeah.
Yeah. It's amount per bottle. So we could do.
We just didn't cover lymphatic out of everyone.
Oh, sorry, that was a bit scratchy. What was that?
Echinacea is.
Yeah.
Yeah.
I'm just thinking a lot. Sorry.
Yeah. So there's another formula I was thinking about where we could. It's got a bit more lymphatic, but we'll do this one, and then I'll give you an alternative one. So what relevant actions is the echinacea?
Immunomodulator.
Yeah.
Diaphoretic.
Lymphatic.
Mild sedative.
Mild. Oh no. Mild sedative. What else?
Antibacterial.
Yeah. So that's
Anticatarrhal.
Is it?
Immune modulating.
Yeah, we've got that.
Oh yeah.
Spelt that wrong again.
Anti-inflammatory.
Is it anti-inflammatory?
My notes, yes, but sorry.
Does anyone else have that?
Yeah, in Broad and Cohen it states it's an anti-inflammatory.
Okay. Anti. Okay. And what about verbascum thapsus?
Echinacea is also an adaptogen.
Adaptogen, yeah. And then verbascum thapsus?
Mucous membrane tonic, I think.
Yeah.
Demulcent, is it?
Yeah.
Is it?
demulcent and antimicrobial.
Microbial.
And anti-inflammatory.
Licorice, so we've got all these as well, haven't we?
Demulcent and adaptogen.
Yeah, so spell that wrong again. Yeah. Anything else?
Mucous membrane tonic.
Everyone happy with that?
Yeah.
Yep.
Yeah. And then, so dose, I'll just pop it here. So dose, what are we going to do?
5 mils 3 times a day.
Yeah.
And would you take it with food or before food or after food? What do you reckon?
I think, has anyone taken a high dose of echinacea?
Yep.
Yeah. What happens when you take a high dose?
Yeah, your mouth is all like tingling and numb.
Yeah, and you salivate a lot, don't you?
Yeah.
It can make you feel a little bit, I think, on a really empty stomach, personally, I think echinacea can make you feel a little bit nauseous if you have a high dose.
Yeah.
So I would take it after food.
Yeah, me too.
Yeah, it just depends. You know, some people have better time. I would actually get her to gargle this. What do you think?
And swallow.
Yeah, after food.
Wouldn't you prefer her to gargle salt and then have this formula?
Yeah, I like the idea of the gargle with the salt. That's a good idea.
Okay, we could do gargle salt.
And also, if her stomach's a bit like underproductive at the moment with allergies and stuff, like it might not be able to take the bacterial swallow.
Yeah. Yeah, so you could do gargling salt, and then you could just have the herbs. I'm just thinking the demulcent action as well with the herbs.
Yeah.
Getting that at the back of her throat as well would be really good. So I'm not going to type it up, but an alternative formula you could use. So you could use the licorice. So glycyrrhiza glabra, you could use the echinacea. You could also put in calendula as...
Yeah, I like calendula. That's nice to go with those.
Yeah.
Licorice, calendula and what?
And echinacea. So you could, instead of the verbascum, you could put calendula in it. Might taste a bit better.
Yeah, I think I like that more with the calendula. Those are really nice herbs together with the licorice calendula.
And good demulcent as well.
Yeah, so we might.
It's also a good vulnerary, so it would help because she's actually got like pustular stuff going on, hasn't she?
Yeah, vulnerary.
And that's good. It just stays the same as well, 30 and 1 and 2.
Yeah, yep, so you could stay the same. That's all right. I don't know how to spell vulnerary, that's okay. So we've got, is that all covered? It's not a demulcent, is it? Take that out. We've got demulcent covered. Is it anti-inflammatory?
Yeah.
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 And it's, oh no, hang on, it is antimicrobial, isn't it?
Yeah.
Is it a mucous membrane tonic? No.
It's lymphatic as well.
Yeah, sorry, that was the main one I was after. Okay. Anti-inflammatory, antimicrobial. Okay, so we've just, do you want me to just go back? Because we've gone through a lot of screens. So just to summarize the case, just for people that are going to listen to this later as well. So we've got, our diagnosis is tonsillitis. We've got chronic lowered immune system with frequent antibiotic use, possible low hydrochloric acid. We've got some food intolerances, so possible leaky gut there, I would say, and gut dysbiosis. So our main treatment objectives. So we're going to eliminate the infection, minimize and reduce inflammation by soothing the throat. We're going to support the immune system via enhancing lymphatic clearance and decreasing congestion, restore mucous membrane integrity, support her nervous system and increase her energy levels. And our long-term goal here is to long-term, so reduce the occurrence and duration of her tonsillitis. So under eliminate the infection, we had antimicrobial, and we had Hydrastis canadensis. We could put Echinacea in there, and also Calendula.
Yeah.
Officinalis. So we've got those in there. Immunomodulator, we've got Echinacea species, so Baptisia tinctora, Sambucus nigra.
Calendula.
Oh, yeah, and Calendula. And so minimize and reduce inflammation and pain by soothing the throat. So we've got demulcent, we've got Glycyrrhiza glabra, Althea officinalis, Vibascum thapsus. Abilities. Anti-inflammatory, we've got Glycyrrhiza glabra, Althea officinalis, Vibascum thapsus, Echinacea species, and Boswellia serrata. Analgesic, we've got Melissa officinalis, and sedative, Melissa officinalis, and clove. So we could we could give them Melissa in a tea, couldn't we?
Yeah.
Yeah, yeah. So we've got support the immune system via enhancing lymphatic clearance and decreasing congestion. So we've got lymphatic, calendula, Echinacea, Gallium, and Phytolacca decandra. So we've got immunomodulator, Echinacea, Baptisia tinctora, and Sambucus nigra. Anticatarrh, we've got Sambucus nigra, Hydrastis canadensis, Echinacea species, Plantago lanceolata. So reduce mucous membrane, restore mucous membrane integrity. So we've got mucous membrane tonics, Hydrastis canadensis, Vibascum thapsus, Glycyrrhiza glabra. Support her nervous system and increase her energy levels. So we've got adaptogenic, we've got withania, Echinacea species, and Glycyrrhiza glabra. And antioxidant, we've got Sambucus nigra. And then our final formula, so we've got Echinacea at a 1 to 2, and we've got 40 mils. And our relevant action is an immunomodulator, lymphatic, mild sedative, antibacterial, anticatarrh, anti-inflammatory, and adaptogen. And Calendula officinalis in a 1 to 2 ratio at 30 mils as a lymphatic, vulnerary, anti-inflammatory, and antimicrobial. Oh, I don't know how I just drew on that. So then we've got Glycyrrhiza glabra, so licorice, in a 1 to 1 or a 1 to 2. I'll just put that could be a 1 to 2 at 30 mils, and that's as a demulcent, antimicrobial, anti-inflammatory, adaptogenic, and mucous membrane tonic. And our dose is 5 mil 3 times a day after food. Our other suggestions, we've got gargle with salt water to get rid of the infection and spit that out. And we could do a tea, couldn't we, as well?
Calendula.
Yeah, so we've got a mix, but we could do Melissa. We could even look at something like the sage, so the Salvia officinalis. Other suggestions here are Mentha piperita and Achillea millefolium.
Thanks very much. I'm going to have to go now.
Okay, thank you. Thanks for being involved.
Okay, no worries. Thanks. Bye.
Bye. What does everyone think of that tea?
Yeah, good.
Yeah, so we've got, I'll just repeat that, Achillea millefolium, Mentha piperita, Salvia officinalis, and we're going to put Melissa in, weren't we? Melissa officinalis. And for a dose of that, we could do 3 heaped teaspoons in an infusion, and put some honey in to taste. We could even do Manuka honey, and drink that twice a day. You guys like that one?
Yeah.
Okay.
That one, did you say it was Mentha, paprika?
Yeah, so peppermint.
Salvia, Melissa, and there was one more.
Yeah, Achillea millefolium, yarrow.
Yeah.
Yeah.
That's a Yelp tea, isn't it?
Yeah, like a yep. Yep. But we put the Melissa in, and we put the sage in as an antimicrobial and soothing. And okay. Do you want me to repeat that, or are you happy with that?
All good.
All good? You're welcome.
Yeah, all good.
It's been great. Everyone's in the dark now.
Thank you.
You're welcome. And I'll
see you next week.
Yeah, see you next week. Have a great week. And yeah, I'll see you then. Take care, everyone.
Yeah, you too.
Okay, see ya.
Bye, everyone.
Bye.
Bye.